Hello and welcome to Patient Power. I'm Andrew Shore. In our continuing effort to educate you on the latest in myeloma, we attended the Myeloma 2014 meeting, bringing world experts together in Boston. And there was a lot of discussion about research using the immune system to fight myeloma, including the idea of a vaccine therapy using dendritic cells to help the immune system recognize the myeloma cells and eradicate them. A leading researcher in the field is Dr. David Avigan from the Dana-Farber Cancer Institute in Boston. He sat down with Patient Power to explain his research.
So we know that the immune system plays an important role in cancer and specifically in multiple myeloma. It seems that as patients have more advanced disease, the immune system seems to work less well. And the question for immune therapy is there a sort of thoughtful way that one can recreate the immune targeting and recognition of the tumor cells as foreign, to educate the immune system to essentially go after them while minimizing toxicity to normal tissues and creating what we hope would be a relatively small or low level of side effects. Our particular focus has been in the field of tumor vaccines, where the idea is that one is trying to educate the immune system to see myeloma cells as foreign and in that way sort of target them. I think the broader field right now is thinking about both how to integrate those type of approaches with other ways to basically modulate the immune system to make it more active, to undo some of the negative consequences of the disease that seems to downregulate and downmodulate the effectiveness of the immune system. So the idea behind our vaccine, for instance, is that we're taking patient-derived myeloma cells and putting them together with immune-stimulating cells known as dendritic cells. And by creating that combined or fused cell, one can present parts of the myeloma to the immune system in a way that's much more easily detectable. And so one can generate an initial response against the disease. The concern is that what will then follow is some effort by the disease to sort of down-modulate or turn down the response. And so integrating a vaccine approach with other ways to try and activate or stimulate the immune system are thought to be a very powerful combination. And in that sort of context, we've been looking at medications such as lenalidomide, which we know is an immune activating agent, and other drugs, particularly the drugs that we talked about that target the PD-1, PD-L1 axis, that seems to be an important part of how tumor cells evade the immune system. And so we're trying to undo that, both alone and in context of our vaccine. Well, I think what we've learned is that there's a lot of incremental changes that have happened really, I would say, somewhat dramatically in the last 5 years of new therapies that seem to have effectiveness in myeloma. Unfortunately, none of them in and of themselves have been effective in eradicating disease completely, but have certainly taken steps in reducing the disease burden, helping patients live longer and with better quality of life. We hope through integrating the immune therapy that we were talking about in that larger context that we start to work against the residual disease that can survive those other therapies, and to either create, of course, our ultimate goal, complete eradication of disease and cure, but we hope that if we're not able to achieve that right away, we will still have an impact on how well we are able to control the disease and how long people live. Well, myeloma is a fantastic example of a sort of disease that has really benefited from the partnership between caregivers and their patients in trying to look towards new therapies. And it was through that partnership that we really expanded the possibilities and opportunities for patients. I think that it's a very generous thing for a patient who's facing a difficult illness to think in that term. And we hope, of course, that any individual study that we do will benefit that individual patient. But of course, the nature of a study is that you're still learning and trying to understand its full impact. So my general feeling is that well-designed studies have generally brought therapies that we know have some efficacy in combination often with newer treatments that we hope will add to that benefit, and that patients, in exploring that together with their physicians, will hopefully help themselves and also move the field forward. So I think that partnership is critical.
We'll have a lot more on immunotherapy for myeloma, including what happens with the research in vaccine therapy. So be sure to be signed up for alerts on our website so we can let you know whenever we post something new. I'm Andrew Shore. Remember, knowledge can be the best medicine of all.